If a patient comes in with sweating, diarrhea, pinpoint pupils, and difficulty breathing, stop. You should be thinking organophosphate poisoning. This happens from exposure to pesticides or nerve agents and causes excessive acetylcholine, leading to cholinergic overload. Boards love the SLUDGE symptoms: salivation, lacrimation, urination, diarrhea, GI upset, and emesis, plus bronchospasms and bradycardia. The biggest danger? Respiratory failure from bronchial secretions and airway compromise. This is an emergency. Treat immediately with atropine to dry secretions and Pralidoxime to reverse the toxicity.